Okay, welcome back to HIMSS 10. This is Better Health coverage continuing here. GetBetterHealth.com. And we're here talking with Mac McMillan, Chairman and CEO of CynergisTek. So thank you for the time here this afternoon, sir.
No problem.
So for people who may not be that familiar with CynergisTek, what can you tell me about it?
CynergisTek is an information security firm. We've been working in the healthcare space for 10 years. That's where we specialize. Most of our clients are hospitals. We have some large physician practices that we work with, but primarily that's what we do. We help folks with their developing secure solutions, helping them secure their systems, their data, and of course, obviously meeting all the compliance requirements that are coming down the pike.
Oh yeah, of course. Yeah, security is a big big issue. So I mean, I'm a family doc, and I have a small practice up there in Ohio. So what kind of solutions can you offer a business like mine?
Well, I think the first solution I can offer y'all is to wait out, right, for a second, which is probably not what you'd expect to hear.
No, that's fine.
And the reason I think I say that is because one of the big debates and one of the big issues that I've been dealing with lately, and I sit on the HIMSS Privacy and Security Steering Committee, and so I've been involved in a lot of the discussions around meaningful use and certification, et cetera. And one of my big pet peeves is that there really isn't a lot of clarification around the government's security requirements. And the other thing that I have a personal I guess bias about is that they're not well defined or structured, if you will, for the different environments that have to deploy them, which I think is a real shortcoming. I mean, when you look at other industries and you look at security requirements in other industries, they take into consideration the size of the organization. They take into consideration the complexity of the environment. They take into consideration the level of risk that might be present there with respect to either the volume of business they're doing or the volume of data that they're handling, et cetera. And they typically, while they may have basic minimal requirements for a security program, if you will, there is latitude in terms of how they're actually applied, and I think that's really important in healthcare. And healthcare needs to figure out how to do that, because as we all know, and you guys know in spades, there's a heck of a difference between a doctor's office and a hospital. Mm-hmm. Right? And I think we can all agree that there's a heck of a difference in terms of the level of risk as it relates to any one of the three elements of data security, whether it's confidentiality, integrity, or availability. If the system is down in my doc's office when I go to visit him, which I did unfortunately before I came here because I was getting over a cold, he still can see me. He can still pretty much do most of the things he needs to do. It's not going to interrupt my visit. If the system is down at a hospital, we have a real issue, right? Sure. Services can be delayed, operations can be delayed. There could be real effects. My doc knows me and has known me for a while, right? So even if he's not looking at my chart, half the time when I come in and sit down with him, he says, last time you were here, we talked about this, that, and the other, and I'm sure he probably looked at my chart as he was walking in or whatever. But I think after 8 years, he knows me a little bit. Probably a little bit more than just a little bit, but the point is that if he doesn't have an electronic medical record there and sitting in front of him, I think he still he can still take care of me, and I think that's, although you want him to have all that capability. I think the difference is when I present myself to a hospital who doesn't know me from Adam and has no history with me whatsoever. The integrity of that medical record and the data that potentially is in there that they're looking at, that care team is incredibly important because they don't know me from the next guy.
Right.
So the risk is, again, much different there. And when you look at it from a confidentiality perspective, I mean, unless I'm wrong, I think, again, I go back to my own experience. My doctor's office, the folks that have been working in there with him, have been there, and for the 7 or 8 years that I've been going to him, I know all of them. He knows all of them. It's a very small group. If something happens, it's a very small group to start looking for where it happened. And there's not a lot of turnover there. You take the average hospital that has hundreds, if not thousands, of employees with a 10% turnover each year. The level of issue or potential issue with confidentiality or breaches of confidentiality are exponentially different than from a private practice in a hospital environment. So I think security measures have to also be tailored in that fashion. We have to take in consideration the environment. We have to take in consideration the risk. And it needs to be, we need to make it simpler for the average physician to get their job done and do the things they need to do and be able to take advantage of the technology without being killed by some regulations that maybe fit a hospital but don't fit a doctor's office.
Right. Well, just with talking with people or being involved with your HIMSS committee, is it frantic out there, or is that the sense that you get from your experience in this?
I wouldn't say it's frantic, but I I think the problem is that we're still trying to size the solution to a one size fits all approach, and I just think that's where we're falling down, because it's not a one size fits all. The average physician practice is not the same as a large physician practice or a specialty hospital or a large hospital or an IDN, or an HIE or a major health system. And I think that while the basic requirements ought to be the same in terms of you ought to have access control, you ought to have protection of the data, there ought to be password controls on systems and that sort of thing, the difference ought to be in how those things get applied and the level of rigor that somebody has to go through from a testing or certification or validation perspective.
So as far as CynergisTek, then you offer hardware solutions or software solutions or both? Or
we're primarily a consulting organization, so we consult into the big hospitals or the hospitals in the sense of how to develop a program that makes sense in their environment. We consult on the various security technologies that are out there that they can deploy to meet the various requirements that they need to meet. We do a lot of security testing and a lot of risk assessment and audit of security programs to help people improve those, and that sort of thing. We're not a hardware vendor. We're a consultant organization.
Oh, I see. And then you already kind of talked a little bit about it already, that the approach that a hospital would take, that an approach that an ambulatory office would take, would be a totally different approach. It might.
Yeah, and it needs, and I think it needs to be sized that way. I think we need to take a step back and do a better job of clarifying the requirements and clarifying them based on the level of risk and the organization that we're dealing with, and not assume that. And this is one of my other. I mean, I've been in security for 30 years. So if somebody says to me, "What do you mean by evaluation?" I can tell you what the doctrinal definition is. I can tell you what the best practice is in, say, the finance sector or the government sector. I can tell you what I would recommend based on whatever you're doing with respect to your systems and how they're deployed and whatnot. But if I ask the average physician, if I asked one of y'all, what does evaluation mean, and what's the best practice for you in terms of evaluation of your system, what would you tell me?
Yeah, I wouldn't even know. I have no idea.
And that's the problem I see with both HIPAA and high tech in terms of the requirements, is that there's not any clarification around what's expected. So I get questions all the time from CIOs at hospitals with respect to, what is actually required of me? What is it I'm supposed to do? I see this requirement to conduct a risk assessment, but it doesn't say how often, it doesn't say when, it doesn't say what, it doesn't say to what level, it doesn't say what I need to produce in the way of evidence that I've conducted it, etc. And so how do I know what's acceptable, what's not? How do I know if an auditor walks in tomorrow and looks at my program and says, have you done a risk assessment, if they're going to accept what I give them? Whereas in just about every other industry that I'm aware of that's regulated, there's some standard or some model that's provided as at least a model that one should follow.